We all have COVID fatigue right now, and there appears again to be mixed messaging and debates about the latest surge of the pandemic. We do know Omicron is highly transmissible, clearly. Infectious disease specialist Dr. Kristin Englund from the Cleveland Clinic is here to talk a little bit more about what we need to know. Now, Omicron is more contagious, but does that mean it's necessarily more dangerous?
Good morning. Thanks for having me on. So yes, absolutely. Omicron is much more contagious than the Delta variant was before. Now, as far as dangerous, you'll hear that it is less symptomatic in many people. And while that's true for the majority of the population, there are still plenty of people who are going to get very severe disease and potentially die from the Omicron variant. So it is not something that is very benign and that is just going to be like a cold. There are many people who are dying every single day from this variant.
President Biden has doubled orders of antiviral pills for Americans. The antiviral pill, though, is specifically for those who you're talking about there, the people who have pre-existing conditions, who have, comorbidities. That's the term I was looking for, searching for there, whether they're vaccinated or not. Is this something that those who are vaccinated should look to if they've become sick and have mild symptoms right now?
So if you're having mild symptoms, that is unlikely something that you're going to want to be using these medications for. What we're looking to do is there are very few doses of this available in the country right now. And I know President Biden is trying to ramp that up, but it takes time to produce these medications. So you're not likely to go to your retail store right now and be able to find this. What we're going to have to do is really focus these doses that are available to those folks who we are concerned are most likely to be hospitalized and are at highest risk of dying from the disease right now. So if you're trying to look to shorten the time frame of time when you're going to be having the sniffles and a cough, you're not likely to get the medication at this point in time.
What about healthcare workers? I know the CDC is actually saying that healthcare workers specifically can actually return to the job following 7 days of isolation if they're asymptomatic. Of course, that can be cut down if there are staffing shortages, which has been a huge concern across the country. But would those antiviral treatments be first doled out to those who are frontline workers?
So we truly are in a crisis situation across the hospital systems, all across our country and frankly, all across the world. So the CDC's decision to shorten the time frame when healthcare workers can get back into the job, I think is very reasonable at this point. We know the time frame of shedding the virus really only occurs a couple of days before you're ill, and then for the probably 2 to 3 days after. So that 5-day time period, as long as people are feeling better, is very reasonable at this point. Are we going to be giving these medications to frontline workers? I think it's different in every single case, and it really depends upon the comorbidities that you mentioned earlier. If a healthcare worker is at risk for getting more ill, then yes, they should be put to the front of the line. But otherwise, we're really going to have to be focusing it on every single patient's situation.
Thank you so much for watching. Make sure to click on the red subscribe button below so you can get more of NewsNation's fact-driven, unbiased coverage.